day to everyone joining us, and welcome to today's Xtalks webinar. Today's talk is entitled The Critical Need to Address Mental Health in the Rare Disease Community. My name is Sonia Hunt, and it is my pleasure to be your Xtalks moderator for today. Today's webinar will run for approximately 60 minutes. This presentation includes a Q&A session with our speakers. This webinar is designed to be interactive, and webinars work best when you're involved. So please feel free to submit your questions or comments throughout this presentation by using the questions chat box, and we'll try to attend to your questions during the Q&A session. Now, this chat box is located in the control panel, which is found on the right-hand side of your screen. If you require any assistance, please contact me at any time by using this chat panel. I'd also like to welcome our attendees viewing this presentation from our LinkedIn Live event, and I encourage you to submit questions as well via the Comments tab. At this time, all participants are in listen-only mode. Please note that this event will be recorded and made available for streaming to those who register on xtalks.com. At this point, I'd like to thank Rare Patient Voice, who developed the content for this presentation. At Rare Patient Voice, they connect clients with patients and family caregivers for participation in all types of research studies. With a community of over 185,000 across 9 countries and covering 1,500 plus conditions, they recruit for studies including market research, health economics, and outcome research and clinical trials. They partner with advocacy groups, attend patient events, and leverage referrals, ensuring high-quality, engaged respondents. Clients trust them for their precision, dedication, and ability to deliver, no matter how challenging the recruit may be. Now it is my pleasure to introduce you to our speakers for today's event. And first, I'd like to welcome Pam Cusick. She is a leader in patient engagement with more than 3 decades of experience in research design, implementation, and advocacy. As Senior Vice President of Rare Patient Voice, RPV, she works to ensure that patient and caregiver experiences help shape the future of medical research. Beyond RPV, Pam contributes to the advancement of women in healthcare through her work with Women in Research, the Healthcare Business Women's Association, and the International Society for Patient Engagement Professionals. She continues to mentor emerging leaders who share her dedication to connecting patient advocacy with meaningful scientific progress. And next, I'd like to welcome Chris Anselmo. He's a patient advocate, author of The Hello Adversity, and Chris is a Connecticut resident living with a rare muscle disease called limb-girdle muscular dystrophy type 2B. He writes about his journey in his newsletter, Hello Adversity, where he shares reflections on cultivating resilience in tough times. Now, with the introductions out of the way, it is now my pleasure to pass the mic and the controls over to Pam. So, Pam, when you're ready, you may begin.
So thanks so much again, everyone, for being here. As Sonia mentioned, I am Pam Cusick, Senior Vice President at Rare Patient Voice, where we connect patients and caregivers with all kinds of research opportunities. And I'm thrilled to have with me Chris Anselmo, who is going to do a little intro for himself.
Hi, everyone. I'm Chris Anselmo. I live with a rare muscle disease called limb-girdle muscular dystrophy type 2B. I am a writer of a newsletter called Hello Adversity, and I'm really excited to join all today.
Thanks so much for being here, Chris. So again, with Rare Patient Voice, we connect patients with all kinds of, and caregivers with all kinds of research opportunities, and several times a year we do internal studies so we can share research back with patients. And this time we thought it was important to do one about mental health and rare disease, as that is a very important topic, and we've heard a lot about it at recent conferences. So we sent a survey out to our community, and we were so lucky to have 958 respondents. They were patients and caregivers in the rare community in the US. As you can see here, mostly patients responded, but we do have a good number of caregivers. Mostly female, mostly white, but also a good mix of age ranges and a good mix of incomes. Within the survey, patients provided insights into their emotional distress levels, types of challenges they face, support systems they utilize, and unmet needs. So the first section of the survey we focused on was emotional distress, and we asked patients about the how often they experience emotional distress that impacts their daily living. Next slide, please. So what we found was that emotional distress that impacts your daily living is the norm for most patients and caregivers in the rare community. So it's not only a once in a while thing. This is something that impacts their day to day. So 8 out of 10 people living in the rare community experience emotional distress that is impactful, either sometimes, very often, or often. And that's a big deal, because when people face emotional distress or depression, anxiety, other mental health challenges, they're less likely to adhere to medication regimens. They're more likely to go to the ER, as an example, and they're also less likely to continue with clinical trials. So emotional or mental health burdens are an impact across the industry, and is something that we really should be paying attention to. Chris, is this a good time to jump in and talk about your journey?
Yeah, no, this didn't surprise me to see. I mean, a rare disease diagnosis is such a jarring experience, and obviously I don't speak for the entire rare disease community, but just from my own experience, I was diagnosed when I was 21 years old, and that's around when I started having symptoms. I started having muscle weakness, and now I use a wheelchair full time. But I tell people, the physical symptoms, certainly the muscle weakness and whatnot, were difficult, but the hardest part of my journey actually was the emotional and mental side of it. Obviously the changes to my body, but also the lack of stability. Like the weakness never really plateaued; it just continued, and that was really hard. The impact on sleep, the hassle of dealing with different stakeholders, and just trying to find an accurate diagnosis and understanding of what was to come. Contending with a world that's not really the most accessible, dealing with self-confidence issues. Again, I'm a young adult, so I'm trying to navigate all the things that young adults have to deal with as well, and just everything was intertwined, and all of that really led to a lot of heavy emotional burden. And so like when I tell people, the physical symptoms certainly are important, but it's also, when you think about the rare disease experience, it's important to also consider the emotional and mental toll that can take as well.
Absolutely. Thanks for sharing that, Chris. Next slide, please. We have our first poll question for the audience.
Okay, and I'm just going to jump in right now and launch that blue screen. We'll take over, everyone, and just to see it there. Okay, so please go ahead and make your selection. What do you think is the most common type of emotional distress experienced by rare disease patients and caregivers? So please go ahead and make your selection with the options that we do have below. Now remember, this is done in real time. So I'll open this up for about 45 seconds to get everyone to participate, and then I will close the polls and then take a look at the results. And we have about 3 polls for us to go through. So please go ahead and make your selection. Much appreciated. Thank you. Okay, that looks like it's half of our audience. I'm going to leave it open for a few more seconds there, Pam, just to ensure we get everybody's involvement.
Sure.
Okay, that looks like it's it. Okay, thank you very much, everyone, for participating in poll question number 1. I am now going to close the polls, and let's take a look at the results. Okay, here are the results. We have 13% of our audience that said anxiety about the future, and then another 13% said depression and sadness, 6% for anger and frustration, 13% for social isolation and loneliness, and 56% of our audience chose all of the above equally. So thank you very much, everyone, for participating in our first poll question. Now back to you, Pam.
Thank you so much. So those results mirror quite well what our audience said. Our respondents said to the survey. Can you go to the next slide, please? So the majority here, they were able to do, this was an all you can, they could select multiple answers. So here, anxiety about the future was the thing that they found to be the most challenging. And then again, also stress and worry about the future was another one. The other one, which more anecdotally I have heard from patients and caregivers, is the lack of understanding from other people who are unfamiliar with their rare disease, or see them somewhere and say, "Well, you look fine," or "Your child looks fine. What's wrong with them," or whatever. And it not having that people understand what they're going through causes a lot of stress. Chris, what are your thoughts about this?
I can definitely validate all of these. I've experienced them myself, but I think the ones that really stand out, just the overwhelming just sense of uncertainty about the future. Not necessarily that things are always going to be horrible, but just that you don't always know what's ahead.
Mm-hmm.
And because a lot of these rare diseases, you kind of have an idea of how it's going to go, but even then, there's still a lot of variability, and it's not always, like I'll say a more common disease where you kind of have a good sense of what's to expect. So there's always that latent uncertainty, latent anxiety that comes along with the uncertainty. And, the one at the bottom says, "I need a break." That can be for both caregivers and for, patients, because it's just like, it's exhausting. Again, not, to be, in a sense, to be pitied, but just like it's always there. It's always beneath the surface. You always feel like you're tired, and there's just a lot to think about and juggle in your mind, and that can just wear you down over time. So that was one that definitely stood out to me as well.
Interesting. Thank you so much for sharing that. Next slide, please. So in asking the community about what was their one greatest challenge, this was an open-ended response. So again, we pulled all these together. But anxiety about the future was one of those things that was most frequently cited, along with depression, and then also uncertainty. So again, to Chris's point, the uncertainty causes a lot of strain and emotional distress. But looking at some of these quotes here really illustrates the deeply personal nature of these struggles. So, fear about disease progression, survivor guilt, medication access concerns, social isolation due to health limitations, and also the invisible nature of rare diseases causes that lack of understanding. So we heard, there were many more comments that came out. These were just the most common ones I pulled out. But let me just mention here that if anyone is interested in this data set, we can share this. It would be de-identified, so it's anonymous. But if there's data that you can use, we would love to be able to share that. So please let me know after the event if you're interested. Next slide, please. So this was something that we found quite interesting. So while the numbers themselves don't look that different, apparently this is a statistically significant difference between the way women experience emotional distress related to their rare disease and men. And that's not to say that men do not experience any stress or anxiety about their rare disease, but rather they experience it maybe a little bit differently. And so I think rather than saying one is more important than the other, what I would say about this is that there may be different types of support for women and men that would be useful. In fact, a friend that we know, David Hogan, has a rare men's mental health group that he runs, and that is probably very important just to be able to speak to other men, whereas women might want to speak to other women. And that may not always be true, but it might be something good as companies or organizations are thinking about support programs, to be able to create something that is a little bit more targeted for each of these groups might be very, very helpful. Next slide, please. And similar to that difference, we also looked at the difference between patients and caregivers and how they experience emotional distress. And interestingly, they're living in the same emotional reality. So they experience that higher level of anxiety or stress, anxiety, whatever, that mental health challenge they're experiencing at the same level as each other, which is very interesting. And I think from talking to a lot of caregivers over time, they are focused on their patient and the disease progression and getting access to treatments and so on. But they don't focus on themselves most of the time, and no one is asking them either, which is interesting that we see here. They are feeling the same amount of stress. And even maybe more interesting is if you look at the bottom here, where we look at those who shared the percentage of time that they experienced low distress, so either saying not often or never, caregivers were less than 1%. So all I can think of there is, it's they're stressed about their patient, the person, their loved one that they're caring for, and then they also have their own stress that they're dealing with. So it might be cumulative. Chris, what are your thoughts about this?
Yeah, this is definitely true. I mean, the rare disease experience is basically, it's not just the patient itself, it's also the family members, it's also the friends, it's the people surrounding them. It's really a shared experience. And just from, anecdotally, my parents have helped me with caregiving needs over the last few years, and I know that it's stressful for them, and for various reasons, and it's just something that doesn't always get it's not something that's always perceived or noticed. The focus always is on the patients, and rightfully so, but the caregivers as well also bear the brunt of a lot of the same sort of emotions about the journey. I know several people who are caregivers, they're parents of children that have rare diseases, and just seeing it through their lens, they've had to sacrifice so much, careers, their time, their free time, social lives, obviously all the fears and frustrations that go along with trying to care for your loved one. And it's just, so it doesn't surprise me to see that there's, similar overlap in those feelings.
Yeah. Okay. Thank you so much for sharing that. Sonia, next slide.
And I'm going to jump in and launch our second poll question. And there you go, everyone. And just like before, this is done in real time, so your participation is strongly encouraged and very much appreciated. In your experience or opinion, who typically bears the greatest mental health burden in the rare disease journey? So you have a couple of options below. Please go ahead and make your selection. Is it the patient themselves, the primary caregiver, both equally, extended family members, or it varies case by case? So please, everyone, please go ahead now and make your selection, and I'll leave this open for another 20 seconds to get everyone involved. Thank you. Okay, Pam, that looks like it's the majority of our audience. So with that, I will close the polls now, and let's take a look at the results. Thank you very much, everyone, for participating in poll question number 2. Okay, so here are the results. In our audience, 26% said the patient themselves, 0% for the primary caregiver, 21% for both equally, 0% for extended family members, and 53% chose it varies case by case. So thank you very much, everyone, for participating in our second poll question. Now back to you, Pam.
Thank you so much. Yes, those are interesting results. I think it would vary case by case depending on your life situation and how you, what point of the journey that you're on. So that was very interesting information. Next slide, please. So this was a quote from one of the caregivers that that responded, and I found this very interesting. So he said, sometimes feeling a bit resentful towards the people that he cares for, but knowing that he shouldn't. Maybe it's normal to feel that way, but he doesn't have anyone to share the feelings with, and doesn't know if he would, even if he did have someone to share it with. So what I found interesting about this, and the reason I highlighted it, is I wonder if maybe if someone offered him, the opportunity to share his feelings like this, if maybe he would. I think most of the time, what I'm finding or hearing from the community is the caregiver isn't really asked to share their feelings. Everything is really about the patient and how the patient is doing. And so this was very enlightening to me, I thought. So that's why I popped it in here. Sonia, next slide. So the next part of the survey focused on how people get support for their mental health. So, and this was very interesting, I thought, to me, because what you see here is that it's really informal support that they're relying on. So they're relying on friends and family and peer connections to help them with their mental health challenges, their anxiety, and their depression and fear. And only 30% are going to a healthcare professional, or not healthcare professional, a mental health professional to get help. And I think that reveals a critical gap. From my experience and just again talking to people in the community, I think it's more about not being offered that kind of service or not really knowing where to go. But there also are other burdens that we'll talk about later. But the accessibility and being able to afford to go to a mental health provider. A lot of mental health providers are out of pocket. So if you're already not able to work because of your rare disease, that could be a huge barrier. So I think that's a very important thing that we should look at as as people who support and care about rare patients and caregivers. How do we get them access to the mental health support that they need? Next slide, please. So here we asked for the top strategies for managing their mental health, and you can see here a few quotes, but they were centered around things like self-care practices, community support, therapy or mindfulness or faith. People relied on different things to help with their mental health. Chris, what are your strategies for managing mental health?
All of the above. Aside from faith, which has always been a part of my life, the interesting thing about these other ones is that it took me several years to really catch on that these could be helpful. The benefits of mindfulness and meditation, certainly community support. It took me a long time to really open up about what was happening to me and to seek support from those around me. Going to therapy, seeing a mental health professional, and then just basic self-care practices. A lot of that, unfortunately, I had to learn through trial and error. Mm-hmm. And looking back, I wish that I had, first of all, known about the effectiveness of a lot of these, but also just that I had sought them out sooner. And not to shamelessly plug my newsletter, University, but really the goal of me starting that was to take everything that I had learned and then be able to repackage it in a way that hopefully would be helpful to other people, so that they would have sort of a centralized resource if they were going through something similar. So I just, in the last few years, I've just been motivated to come up with the resources that I wish that I had found, so that others could find them sooner. Because I recognize the importance of how helpful these can be, but also, making sure that they are available when you really need them, versus having to find them later on, or just not knowing that they're available and not knowing that they're effective. It's really important to have as early an intervention as possible with a lot of these, because I think it can make a profound difference and really shape your rare disease journey.
That's fantastic that you provide that, that resource, because I'm sure it's really helpful to a lot of people who don't really know where to turn, and this is a great place for them to start. Sonia, next slide, please. So what we found in terms of the reasons people have trouble with finding mental health care professionals, we asked them if they have sought mental help with their mental health, how easy or difficult was it to find someone who understood their rare disease challenges? And nearly 60% had trouble finding anyone who understood their rare disease. And why that's important is when they're going to talk to someone about their stress and anxiety and depression, or uncertainty about the future, they then have to go in and explain their whole what their rare disease is and how it impacts them, and spend all their time like reliving their disease area rather than talking about their mental health. And so this is where, one of the patients said having a aware healthcare provider makes all the difference. They see beyond the diagnosis and understand the challenges. And I think that's that's another opportunity, right? Where people who have a specific diagnosis sending them to someone who understands that diagnosis rather than having them have to relive it over and over again is a really important thing. And we heard that loud and clear from the patients and caregivers who responded to the survey. Chris, what are your thoughts on this issue?
Yeah, I see a therapist now who's affiliated with my neuromuscular disease clinic, and it really does make a huge difference to have somebody that understands what the rare disease journey looks like for me and understands my disease specifically. I just think, early on my journey, when I talked to somebody, when I talked to a professional, they just weren't aware. They didn't really know much about the disease, and that it's not that you'd expect them to, especially since that these diseases are so rare, and one person can't know every single rare disease that's out there, but just having somebody that understands can make such a huge difference. And as you said, it's that much more time you could spend actually getting the help that you need versus trying to explain what your disease is, what it looks like, and then spending precious time just trying to get them to remember and understand. And so it's a huge deal to have somebody that is aware of the rare disease journey, or just even generally what's important to rare disease patients as they navigate this journey.
It's really fantastic that your clinic has that resource, because I'm not sure that, at least based on this, the patients and caregivers who responded here, I don't know that that's a common thing, but I think it's really great that you have access to that.
Yeah, unfortunately, it's not as common as hopefully it should be.
Well, I don't know, maybe we'll see a change sometime soon. That would be great. Next slide, please, Sonia. So we also asked about how connected they feel to the rare community. And here, some positive news is that more than half said that they do feel like they are connected, either very connected or somewhat connected to the rare community, which is great. But the more disturbing, on the disturbing side of things, a third of people feel like they are either very or somewhat disconnected from the rare community. And, as with anything, being isolated makes things, makes the emotional burden even much more difficult. So if you don't feel like you have people who kind of get you and understand your experience, it probably is much worse for their mental health. So the important thing here, I think, with this data is, how do we reach out? How do we help people find resources? Chris, I'll throw this over to you in a second, but like Chris's newsletter to help people who, are experiencing a rare diagnosis, how do people more easily find those things so they have a community and they have people they can talk to? I don't know the answer to that, but I think it's a very important thing that we put some effort into helping more people connect with their own community so they don't feel so alone. How do you connect with their community, Chris?
I have a lot of informal connections that I've made over the years. I stay in touch on Facebook and over text, but just looking at this slide, I just think back to the early years of my journey when I didn't seek out connection. I didn't really, there are many reasons for it. We don't need to get into all the reasons, but just I felt very isolated and alone, and I just was hesitant to open up. I was hesitant to really meet other people that had it, because I guess I didn't really want to know what my trajectory looked like. But I'll say that once I finally did meet others with my disease, I did, and in other rare disease patients as well, not just those with my disease, it made a humongous difference. It made, all the difference in just having that support you need, people that understand, people you don't even need to explain your situation to, because they already understand on an intimate level. And, I really, looking back, I wish that I had reached out sooner. I wish that I had met these people sooner, but I'm glad that I did, and I really see the value of connection. And that's one of the top strategies, or the top pieces of advice I try to give people that are early on in the journey, is just to reach out to others. Don't have to shoulder everything alone, and try to find other people that understand, because those are the people that you rely on, that support you. You can share resources, share ideas, share just be an ear to listen to if somebody has something to say. All of those things are so important. And just on the flip side of that, the disconnection of just not having any of that, of being isolated and alone, just makes everything else so much harder.
Yeah, I can imagine. Well, I'm glad you found your people, and hopefully people will find their people soon. Next slide, please. So in terms of the ways people want to connect, this was fascinating to me. So over half wanted to connect in an online forum. So whether it's an online support group, social media, that's where they seem to want to connect most often. And I think, there could be a few reasons for that. It could be, accessibility. It could be, just the difficulty of leaving your home and going to an event. I mean, certainly people like to go to the patient events and in-person meetups. Those things are great too. But having access to online support is, seems to be the way that they really want to connect with people. Next slide, Sonia. So this is another quote that I added in here, that peer connections and support groups provide not just information, but hope and a sense of belonging. So I think that goes back to Chris's point where, you meet other people who have had your experience or are going through the experience you're going to, and you feel like you are connected with other people. You're not so alone. And I often, hear in the rare community that it's, you have a small number of people who are diagnosed with that condition. You may never meet anyone in your community with that. So if you can find someone through an online support group, it's, it gives you that hope, and it does give you people who get you and that you can then, bond with, and then again, have a sense of belonging. Next slide, please. So in describing what their ideal support network looked like, or support system looked like, it was really 4 pillars that were interconnected. So they want to be connected with their community. They want mental health and emotional support from their from providers. They want some sort of care coordination. So when you have a rare condition, you're not just going to a primary care doctor once a year. You're going to see specialists. You're going to see lots of other people, and helping them to navigate that and connect with not only those specialists, but mental health care providers was another element that was part of those pillars. And then, of course, financial support, practical support, helping them to find or access what they need in order to get again, this is focused a little bit more on the mental health side of things, but to get the support that they need, because it's not always easy to find. Chris, do you have any thoughts to add to this one?
I definitely agree with the interconnectedness part, and it's almost like legs of a table. Mm-hmm. If one of these legs is missing, the table's going to fall over, and you need to have support from all 4 of these, because the rare disease journey is such a complex experience, and you need to have, especially having stakeholders just beyond just the community, professionally, financially, in healthcare, just when everyone's on the same page, mm-hmm. that makes things, I won't say easy, but makes things easier. Mm-hmm. Whereas if you're constantly battling with, different stakeholders, it can get very frustrating, and it can just make everything so much more difficult. So.
Right, yeah. Next slide. It's another poll question. This is the last one. Oh, wait, did I skip one? I guess I did. Sorry about that. So this is the next slide. So this was, we specifically asked what patients and caregivers needed from healthcare providers, advocacy groups, and pharma. And they were very specific in what they were asking for. So, and for healthcare providers, they want, people who meet them where they are. They're not just, check a box. They want to be listened to, and they want, mental health screening to be part of, their visits to their clinics or their office visits, so that they are treated like a whole person. And then finally, they want actual referrals to rare aware mental health providers. It's it is hard to find a counselor in so many cases, and in Chris's case, as he mentioned, it's part of his clinic. Maybe that should become the norm, because it's hard for them to find what they want, but they would like some help from their health care providers to identify those resources. Then from advocacy groups, there, more online forums and things that are specific. So maybe groups for caregivers, maybe groups that are for men and for women. They want to be able to, they want things to be accessible. They want to be able to reach out and connect with people. Removing barriers to entry so that they can just join a group and become part of that and, get the benefits from that. And then also, again, focusing on the caregivers. There's, so much caregiver burnout. So maybe, advocacy groups sharing, ways that caregivers can take care of themselves would be a huge benefit. And then finally, from pharma, they're looking for, removing financial barriers, of course, is a huge one always, but also supplying, clear and accurate information and how they access support programs and, how they can, if there's a denial, how they can navigate that. They want, support for the whole person, not just, providing a coupon. They want to be able to feel like they're being supported also by pharma. Chris, you have any other thoughts on the stakeholder support networks?
Yeah, when I look at this slide, I just think about how important it is to incorporate patient and caregiver perspectives into your business processes, your planning processes as early as possible, understanding the journey from beginning to end, what's important to them, what their pain points are, and how you might be able to assist or help. So many times, decisions which are well-intentioned are sometimes made without consulting or considering the perspective of patients and caregivers, and actually ends up making things harder or even potentially causing harm. Just treating us patients, treating caregivers, treating anybody that's impacted by rare disease as an essential stakeholder to bring to the table, and not just somebody that you're doing something on their behalf without really getting their input along the way. I think so much can be made better, but so much could be learned from their experiences, learned from understanding what truly is important. And I think that benefits everybody that's listed here.
Great, very insightful. Now the poll question, last poll question.
Okay, and I will launch that now. Just like Pam said, this is our last poll question, so everyone please participate in this final poll. Which stakeholder group do you believe has the greatest opportunity to improve mental health support for the rare disease community? So please select any of the options that you see below. Is it healthcare providers, pharmaceutical companies, patient advocacy organizations, insurance companies, payers, or government policy makers? So please go ahead, everyone, and make your selection. And just like before, I'll leave this open for another, I'll leave it open for another 30 seconds, as it looks like we have under half our audience members have contributed. So I'm trying to encourage everyone to just jump on now and make your selection. Thank you so much. Okay, Pam, that looks like it's the majority of our audience now. I'm now going to close the polls, and let's take a look at the results. Okay, here we go. So 53% of our audience said healthcare providers, while 13% said pharmaceutical companies. Then 20% said patient advocacy organizations, while 13% said insurance companies and payers, and 0% for government and policymakers. So thank you very much, everyone, for participating in all three of our polls. That's it for our polls for today. And Pam, back to you.
Thanks so much. Well, that's fascinating. So one of the things we learned in a prior study about how patients like to get support, and this was about clinical trials, but the healthcare provider is so pivotal. So I think that they want to learn about clinical trials through their healthcare provider, and similarly, they want support from their healthcare provider to get mental health support. And I think that's a very insightful learning from this last poll. Next slide. So this was another one of the comments from a patient who responded to the survey, that healthcare providers should have resources and literature available when they're providing a diagnosis, that pharma should do everything that they can to support costs and availability of drugs, and that advocacy groups, they just need more of them locally, is what this individual was saying. But that could also be online where, not everybody knows about an advocacy group. We think because we are working with advocacy all the time that everybody is part of an advocacy group. But in another prior study we did, only half of the patients and caregivers who responded were part of an advocacy group. So how do we get the word out to patients? Maybe healthcare providers can help. I don't have an answer to that, but I think it's a very important gap and an opportunity to help patients connect with more advocacy groups. Next slide, please. So finally, what did we learn? So it's, these are just a quick summary of what we heard in the survey. So 42% of the people who responded said, or 43%, that they either often or very often experience significant mental health challenges that impact their daily living. When we add some, sometimes or somewhat, it goes up to 83%, and it's a big number, and so it's something that really needs to be considered and should be something that we address in some ways through either HCPs, through pharma, through advocacy groups, support groups, however we can do it. They need this help, and they don't often know where to get it, because if you look at the next box, informal support, they're really leaning on their family members and their peers in some cases and their friends, which is great that those people provide emotional support, but they're also not professionals. And so there are cases where, a mental health challenge is significant and they need to talk to someone who is not their family member. Oftentimes you don't want to share things with a family member that might scare or upset them. And so talking to a mental health professional is would be a great resource for them. So again, that's another gap where, it would be helpful for them to talk to somebody else other than, their family and their friends. Patients and caregivers are disconnected, a third of them at least. So how do we find a way to connect them with, help them learn about advocacy groups or connect with online resources and support groups? It's something that, would be beneficial to them, again, because, emotional or isolation really has a negative impact on emotional wellness. So that's another opportunity. And then access barriers. So again, that finding those rare, aware mental health providers, something like, again, referring back to Chris's experience, what his clinic offers is beneficial. It's something different than what other people are experiencing, and so something like that would be helpful. So that's all I have to share. Is there anything, Chris, you want to add to the final moments?
No, I mean, this certainly tracks with my own experience and what I've heard from others in the community. And I think, just to kind of summarize everything, when we think about the rare disease experience, thinking about the emotional aspect of it is so important. And I don't know, how much we could lower the percentage of emotional distress, but if you're aware of it going in, and that's even a possibility, that can help you ask the right questions. It can help you give you a more fully formed view of the rare disease journey and the rare disease experience. And hopefully that can help to start to build, put in processes and really take it as seriously as the physical symptoms. Because I think so much of everything is impacted by one's emotions, how they're feeling, how mentally, how they're doing, if they're feeling burned out, if they're tired. That impacts everything. And I think that just as long as that's prioritized, and I think that's really could be some way that you could really start to help patients as well.
Agreed. Thank you so much for being here with me, Chris. It's really been fantastic having your insights.
Thank you very much for that very engaging presentation. I hope everybody enjoyed it. So thank you very much, Pam and Chris. And now we're going to begin the Q&A portion of the webinar, so I'd like to invite our audience members to continue sending in their questions using the questions window on the GoToWebinar control panel there. And if you're watching this via LinkedIn Live events, please go ahead and make your question or comments in the comments section there. Now, while you were speaking, Pam, I did receive a bunch of questions, so let's start with this first one here. This one's a little lengthy. They're asking, you mentioned that 82.4% of rare disease patients and caregivers experience frequent emotional distress. What are some practical first steps that pharmaceutical companies can take immediately to address this crisis without waiting for major program overhauls? Great question there. What are your thoughts there?
Gosh, I think, there are a lot of programs that pharma companies support to help patients understand their diagnostic journey and things like that. Adding a mental health component to that, where an existing program that they already have, so you can sign up for a lot of support programs through these pharma companies, but I don't know that they actually have a mental health component to those. And so, adding something where maybe it's a resource section to help them with rare aware mental health providers, or resources like Chris's newsletter, things like that, where they are providing access to some sort of support would be a great first step. And a lot of those programs are already in place. All they would need to do is add those mental health resources to that. Chris, do you have any thoughts on
that? Not really, but just again, going back to just the whole awareness factor of just understanding the full patient experience, not looking at it just in terms of physical symptoms, but also recognizing the impact of mental health on both patients and caregivers, because ultimately, if you want these patients to eventually potentially take part in a clinical trial or something, you have to understand the full experience. You have to understand and support, if you can financially or through grants or whatnot, initiatives that can help to boost mental health, or even just to help with just that part of the journey.
Thank you.
I'm here in the background just looking at all the questions coming in, so just give me 1 second here as I get it all organized and we go into our next question. Okay, so the data showed that nearly half of the patients feel disconnected from the rare disease community, yet 84% of those disconnected individuals experience frequent emotional distress. How can patient advocacy groups more effectively reach and engage these isolated patients, especially those who may not be comfortable with traditional support group settings? Another great question. Your thoughts?
Yeah. So that's a tricky one. A very good question. I think if we look at where people want to get information, you in the poll said healthcare providers as one example. Maybe. And this is not an easy answer, but maybe getting information to those specialists who diagnose rare diseases, specific information about advocacy groups and support groups. Not everyone isn't posting right online, oh, I was just diagnosed with this. So it's hard to find those people, but you want to make it easy for them to find you. So having a big presence online and having a name to your organization that is easy for people to identify if they are diagnosed with a specific condition would be great starts. But I think for those people who are isolated but who also would like to be connect with people online, they need to be able to find those resources. So again, I would say making it easy for people to find you online is one thing, but if there's a way to connect with specialists who support those communities, that's another great way for advocacy groups to kind of be able to connect with people, especially those who are newly diagnosed.
Okay, thank you very much for that. I have a couple more questions here that we can get to. Here's the next one. Thank you for this excellent content and presentation. Thank you. Can you share the methodological write-up of how you can conduct the survey and analyze the data, especially how you organize the open-ended responses? Did you use AI at all to help with the open-ended analysis?
I did. because there were 958 responses to every open-ended question. So the survey had 20 or so questions, went out to our rare community in the US. And so that was sent out by one of our project managers who, sent out reminders, and we ended up with 958 responses or respondents. And then with that, I then had an Excel spreadsheet with all the data and went through and tallied up different, for the different questions, what each, for the closed-ended questions, that's much easier. But for the open-ended questions, I did use AI and had it put in those responses to come up with what are the top 10, for example, for their ideal support systems. What are the top 10 responses in this data set? And so I pulled that information together that way. Thanks for the question.
Okay, thank you. We'll jump to the next question here. When it comes to clinical research, what aspects of the trial makes you as a rare disease patient more likely to consider enrollment?
Chris, I think that one is more for you, or I can try to answer.
Just full disclosure, I've never participated in a clinical trial.
Mm-hmm.
I do know, just again, anecdotally, that, again, supporting the patient through that experience, supporting the family, in terms of travel, in terms of logistics, in terms of, the experience itself once you're actually at the clinical trial site, providing as much information up front as what that looks like, and then supporting the family unit as they're, traveling to these sites. Because a lot of these sites are hours away. If somebody doesn't live near a city, they might have to travel multiple days, which require hotel stays, which require huge disruptions in terms of having to take off time for school, for work. The more you can understand about that journey and what the sacrifices are involved for somebody that's considering enrolling in a clinical trial or participating, and the more that you're able to address that either through financial support, logistical support, that will boost the odds that somebody would be more willing to participate. Because it's not simply as like, hey, we have a potential therapy, everybody's going to sign up for it. There's a lot involved there. There's a lot of sacrifices. There's a lot of information that needs to be gathered, and it's just important to be able to support them throughout the entire journey and provide as much information up front.
Oh, thank you very much, Chris, for sharing that with us. Okay, I'm going to go and jump to another question here. I think I have time for maybe two more. In the significant gender disparity results, 44% women versus 34% men, what is the impact of mental health stigma that could be higher in men versus women? Another great question.
I think, at least from my perspective, and Chris, you can share in a second too, that men don't talk about their emotions. To that the comment from the gentleman who said he's a 73-year-old man, we don't talk about these things. I think it is much more common for men to want to keep things to themselves, not share that they're feeling stressed or worried or depressed. And I think that's that does contribute to it's a factor that probably that part of it impacts men more than women. Women are even in research, we find women respond more often than men do. Women are bigger sharers than men are in often cases, and so I think that is probably to that difference. Chris, what do you think?
Yeah, that's definitely all true. I think just again, men just have a tendency to want to push through things, to not confront it, to just try to overcome it, or just to push it off to the side and try to live as normal a life as possible. And then when you do that, you might be okay for a little while, but long term it kind of adds up, and you realize you've been suppressing a lot of feelings and a lot of emotions and a lot of fears. And yeah, sometimes that can, you don't realize it until it's too late. And I think just earlier on, just understanding that these emotions are normal and that it's not weakness. It's not, you're confronting your mental health early on. That's not, a sign of weakness. That's actually a sign of strength. And so I think it's just important to kind of just reframe a lot of the feelings that are there, just in a way that's empowering, that and help to say that, like, hey, all these people, all men that have rare diseases are part of the rare disease journey in some way. experience these feelings so that you know that if you feel it, you're not, out of the norm. You're definitely, they're human emotions. It's something everybody feels, so it's not really anything to feel like you failed in any way.
Mhm. Okay. Well, thank you very much, Chris and Pam, for answering all those questions. We've reached the end of the Q&A portion of the webinar. Now, if we couldn't attend to your questions, the team will follow up with you after this presentation. And if you have any further questions, please go ahead and utilize the email addresses you see there on your screen. And there's also the helloadversity.substack.com to check out. Okay. Thank you, everyone, for participating in today's webinar. You will be receiving a follow-up email from Xtalks with access to the recorded archive of this event. A survey window will be popping up on your screen. Your participation is appreciated as it will help us to improve our webinars. Additionally, I have shared a link to view the recording of today's event in the chat box, which you can also share with your colleagues once they register for the recording here as well. So that's in the chat box there. Okay, and for those of you watching via LinkedIn Live events, we encourage you to visit xtalks.com, to visit xtalks.com to register for this event and to gain access to such features as viewing the recording and more. And get even more out of today's presentation by downloading the supporting material that we have there for you under the Handouts tab. Now, please join us in thanking our speakers for their time here today. So thank you very much, Pam and Chris. It has been a pleasure. We hope you found this webinar informative. It has been my pleasure to be your webinar moderator. On behalf of the team here at Xtalks, I'm Sonia Hunt. Please take care until we see each other again. Bye for now. Bye, everyone.